I'd like to introduce who you are. You're Dr. Ralph Cardin. You're a doctor of chiropractic, and you also have a diplomate in internal medicine. And you practice out in Kansas. What's the name of the town?
Overland Park, Kansas. It's a suburb of Kansas City.
Okay, great. And how long have you been in practice?
19 years.
Okay. Okay. So at what point did you decide to get your diplomate in internal medicine and why?
Sure. So what happened for us, we began practicing in a small town, and what we noticed in short order was that lots of people were going to the medical doctor but not getting help, and we felt that we could help them through not only chiropractic but also through good nutritional support. So for years I practiced nutrition, and then ultimately decided, I needed to make the next step so that I could help patients get better care through doing internal medicine work. Obviously, as a chiropractor, we can't write prescriptions and we can't do surgeries, but we certainly can do everything else diagnostically. So I felt like it was important to have those credentials so I could validate that I could help the patients.
Great. So you do like lots of blood work and you look at hormonal levels and
Yeah, we do lots of blood work. When patients come in and they're wanting either a wellness approach or if they have a metabolic condition that they've got a very specific diagnosis on, then what we try to do is expand upon the diagnosis and the workup that they've already had. A lot of times, patients will come into the office and they've got what we believe to be an incomplete lab report, and so what we want to do is we want to expand upon those lab reports. And then at the end of the day, we're still going to implement natural medicine approaches, diet, nutrition, lifestyle changes, with the cornerstone of all that being chiropractic.
fantastic. And at some point you decide to integrate neurofeedback, which is another layer.
That's correct. So what happened as time went on, I felt like I needed an additional instrument in my tool bag, so to speak. And I was fascinated with how the brain was involved in really controlling everything that took place within the body. The chiropractic profession as a whole, it focuses on the nervous system. And so we were told and taught always through school that we were the nerve doctors. We were the doctors that could control everything that was going on with our adjustment. But what I found as I got into practice that I either couldn't make the changes that I wanted or the changes wouldn't stay. So that's when I began to look at adding additional therapies. And for me, what I felt like the best natural approach to help guide and direct the brain so that the brain could do what it was supposed to do was to begin to look at neurofeedback. I needed a way to analyze the brain. I needed a way to analyze the nervous system. And so that's when I began, about 5 or 6 years ago, I began first investigating, and then secondarily, ultimately, I began to treat and implement neurofeedback training into the clinic.
Yeah, and as chiropractors, I think it's important that, as you said, we work with the nervous system, but the brain controls the nervous system.
Right.
And if we don't look at the brain, we're missing, it's like a lot of people just look at from C1 down, but up here, the brain is so important because it actually coordinates and controls the functions of the entire body.
Absolutely. It's a simple process of looking at the brain, but also looking at the effects that the brain has on the rest of the nervous system. Again, as chiropractors, we were always looking, like you said, from C1 down, but we were just isolating everything. At least in our clinic, we were isolating everything just to the spine itself. And we weren't looking at secondary measurements. We weren't looking at pulse rates. We weren't looking at skin temperature. We weren't looking at the brain itself and how it was adapting into the environment in which it was, living in. And so then back to the biochemistry part of stuff, here I'm trying to ask a patient to change their lifestyle dietarily, yet I'm not able to get them to make those changes with their diet just because the brain's not functioning at the best level that it could possibly function at.
Right. So You ultimately decide to go with the neurofinity,
Correct.
which you use something called a stress response evaluation. Can you just briefly describe what that looks like?
So a stress response evaluation is a very simple test. What we do is we want to put the body under stress. We give it four gentle stressors, and then we just see if the body can recover from those stressors. So we do a simple stressor, and then we go into a recovery mode, and we measure six or seven different dynamics: brain, heart rate, respiration rate, skin temperature, those types of very basic autonomic measurements. And we're just looking at, can the body respond in an appropriate way? When we put it under stress, there's a specific pattern we look for, and we put it under rest or recovery, there's a specific pattern that we're looking for. And from that evaluation, then we can determine what type of a nervous system we're dealing with the patient. And then when we integrate more biochemistry into it, then we can also look at how are they going to respond. If it's over what we call an over aroused nervous system, someone that's in a high metabolic rate, their nutrient recommendations are going to be different than somebody who's in a lower metabolic rate.
Right. And my guess is that based upon the type of health problem they have, like ADD, you're more likely to see one set of results on that stress response evaluation versus someone who has, Crohn's disease or something like that.
So sometimes they're very different, but sometimes they're also very similar, which is an interesting manifestation of how we can't always let symptoms rule what is wrong with us. That's why it's really important to get good diagnostic workups, because symptoms are tricky. They're going to lie to you and tell you one thing when your body may be responding, reacting in a different way. And so that way we can customize the therapy and get the appropriate therapy to the nervous system and not necessarily to the condition, which is the basis of what chiropractic has always been about. It's never been about symptom based. It's been about condition. It's been about the very nature of how the body is responding and reacting.
So, what is the youngest patient that you've had do the stress response evaluation and subsequently neurofeedback?
So the youngest that I've had has been a 5-year-old. They were brought in a little bit more ADD and some anxiety issues. So we've been able to successfully implement. It was a patient that I was already treating with chiropractic, but wasn't really getting as much results as I wanted to. So it was a good way for us to objectively identify where the problem was, and then we could focus not only our chiropractic technique, but we could focus more on specific brain training as well, and we can bring that brain back into a better balance so it can function in the environment that it was put into.
Yeah, one thing I noticed in practice is that I had learned the Logan technique actually as part of a prenatal and pediatric training I had done. And, I noticed it with the babies that their digestive issues, started improving because what I didn't realize is a lot of babies are in fight or flight. Their nervous system, and what happens is they get exhausted, and babies get very gentle adjustments, anyways.
Yeah,
And then one day I had this woman come to me who was so severely constipated. She was going to the bathroom about every 10 days and had been to other chiropractors and had been, quote, manually adjusted. And, she felt good, but it wasn't, again, we don't want to focus on the symptom, but the fact that she wasn't going to the bathroom frequently was a problem. And I started doing the Logan technique on her, and she started going to the bathroom every day. I mean, it
wow,
was like amazing because she was just so stressed out. Single mom, in sales, didn't have a steady paycheck and had a
sure.
mortgage. And I think we have to recognize this is the life we're living in these days.
Absolutely. Yeah, I think the stressors that are affecting us on the outside have to be manifested on the inside at some point. And if we can't help people just move beyond the symptoms that they're suffering with and get them to really invest in and how can they help their nervous system long term, I think we're missing the opportunity to really to make a change in most people's lives.
So, can you just briefly describe what a neurofeedback session would look like for those who have no idea what it is?
Right. The easiest way I'll explain it to most people initially is we're going to use technology to basically look inside your nervous system. Specifically, in this case, we're talking about the brain, but we can use this for breathing techniques, and we can use it for heart rate techniques and blood pressure techniques as well. What we're basically doing is we're asking a software or a computer or a set of sensors to monitor a very specific physiological response. And then when we can get that response to change, then we get a reward system. A lot of people know what a Pavlovian response is. So we ring a bell, you get dinner. In this case, I use movies. A lot of times I treat a lot of kids, but I use movies. And so when they can manipulate their brain frequencies to get in a very specific pattern that I'm going after, then they'll get the reward. In this case, it's a movie. What we don't do is we don't do a negative reinforcement. So we don't shock them. We don't play a loud noise to startle them. It's a very gentle procedure that we go through over the course of a training session. And I focus on generally somewhere between 20 and 30 minutes. A lot of that just depends on each person, how much they can tolerate. We've got markers that we monitor as we're doing the training sessions, and so we can tell if the brain's fatiguing or if the brain's doing well. And if the brain's doing well, we'll let it continue to exercise.
Great, great. And then at some point you decided, I think it was a couple years ago, almost, you decided to implement or integrate exogenous ketones into your practice. What led you to decide to do that? What did you know about ketones that made you feel, wow, this is something that would really benefit my patients?
So on the flip side of it, on the nutrition biochemistry side of my clinic, we in addition to a lot of metabolic conditions and diseases that we were treating, and when I say metabolic, I'm talking about cholesterol and diabetes and those types of traditional conditions. What we also had, a portion of our clinic, was weight loss. Lots of people want to lose weight. Lots of people want to feel better, and so we would do low carbohydrate diets. And there's all kinds of names out there. Rosedale diet was one that we used a lot. A leptin resistance diet we used a lot. A paleo diet we used a lot. And one, for very extreme cases, we would use what's called a ketogenic diet, which is where people are severely restricting their carbohydrates. And we had very specific protocols that we would put patients through. And during that journey, we would also have them monitor their urine to see if they actually reach a state of ketosis. What happens when you severely restrict these carbohydrates, as you know, the body will begin to dump as a biochemical pathway. It will begin to excrete through the urine certain byproducts, and we can measure those byproducts on a urine strip, and that'll tell us, yes, you're in ketosis, i.e. fat burning mode, or you're not. And what we found, even though we knew patients were being very specific and very strict with their diet, it was very difficult for them to get into the state of ketosis. So for us, initially, it started as a weight loss process. We were introduced to exogenous ketones, and we found that when patients took a sample, a standard dose of the product that we use, within an hour, they were able to pee on a urine strip and get themselves into ketosis, where they might have gone months on a severely carbohydrate restricted, very strict diet, and yet they still weren't able to really get into ketosis. And so it was a game changer for us, initially for our weight loss patients. That's where we focused on it initially. And so we began using it with them, and people would feel better. They would come back and they would report how much more energy they had throughout the day, or how much better sleep they had, or they noticed in the afternoon they would not only get tired, but their focus would go down, and now they had better focus throughout the day. And so that led us on this journey in the last couple of years of just investigating further and further and further the far-reaching effects that ketones, both endogenous, the kind that our body makes, but exogenous, the kind that we can take on the outside. And we just found that it's just been a great addition to what we do. It's begun to spill over, no pun intended, it's begun to spill over into other areas of the clinic as well. So we're talking about brain and brain health. That's been one of the things that I've started to integrate with my neurofeedback patients as well, and find that with those patients, they can go longer in treatment sessions. So as I was describing earlier, we're constantly monitoring markers as we're doing a neurofeedback training session. And we can see when the brain starts to shift and it just can't stay on task anymore. What I've found is that when I've added the exogenous ketones to those patients, they're able to go longer in training. Their fuel source is a much better fuel source, specifically in the brain. And so it allows that brain to work longer. That's why they have better focus. That's why they have better sleep as well. So long-winded answer. Hopefully that addresses what we're asking.
Yeah, that was a great response. And for me, I started doing the ketones in the end of December. I have Lyme, I have
Uh-huh.
Hashimoto's, pre-diabetic. I mean, my health was a mess. And I was encouraged to do it because I literally had to give up my chiropractic practice. I could not function. I'd stay in bed all day. I was exhausted. It was
Mm-hmm.
just kind of like, everything was just taking over. And one of the very first things I noticed was that my focus was better. Within a week, I could focus for 4 hours, where before I struggled to focus for 5 minutes.
Yeah.
Um, I noticed that my memories improved. Like initially, it was just short-term memory, but the other day I started remembering a phone number that of someone that I haven't seen in 10 years that I've
Right.
been trying to remember because for some reason I don't have her number on my phone, and I just felt like I'm grasping at something. Like I know it's there, I just don't know how to access it. So I'm starting to see those changes as well. So, a couple questions I have for you is, um, do you do, because your focus is in internal medicine, and I assume you're checking for diabetes or pre-diabetes, cholesterol. Have you noticed any pre and post changes for people that? And I want to, just say. Because we have to use this disclaimer, this product does not treat any conditions, but I want to know anecdotally, have you noticed any objective measurements change with your patients with anything from diabetes to, cholesterol to different
Sure.
health problems?
Sure. Absolutely. Yeah. Of course, I mean, we're not using just exclusively, we're in a different circumstance from a clinical standpoint. So I don't want to mislead anybody that it's just exclusively here, take a product and that makes these changes. That's kind of my own short little disclaimer as well, because we always integrate lifestyle changes associated with it as well. For me, I have to find where the patient is. If you don't exercise, we got to get you to exercise. If you're not eating well, we got to get you to eat well. So it's kind of a backdrop includes taking a product as well. With that being said, yes, we've seen A1Cs, which is a measurement for type 2 diabetes. We've seen them, an ideal measurement is below 6 for those that are unfamiliar with it. And we've seen numbers in the in the high sixes and sevens and eights. And even we've had one at a 10 over the course of months of taking the product and integrating those lifestyle changes. We've seen those numbers come down to nearly perfect. We've seen blood sugars come down that way as well. So we're talking a blood sugar below 100, and we've seen insulin levels come down from where insulin's, type 2 diabetes insulin, those numbers are going to be over 15 when you measure those, and we've gotten those under 15. We've gotten them down below 10. So we definitely have seen a lot of objective changes, and that's the beauty of using objective measurements. We want to feel good, but sometimes our body, as we were saying, our body will kind of mislead us, and we might feel one way. In reality, our body's a totally different area. So the other thing that I do, again, we mentioned the stress response test. I've seen objective changes on the stress response test, mostly in a shorter time period. So what might have taken me 4 to 6 months to get a change on a brain objectively can now take me 2 to 3 months to get that same change. So it's really been a significant change from that standpoint as well.
Wow. Well, and the other thing I want to mention is that, and I'm not putting words in your mouth, but do you find that possibly patients are more compliant with the dietary recommendations and the exercise recommendations because again, the ketones will get you out of carb seeking and looking for fats. Hence, for me, it took away all my carb cravings. So for me to make those dietary changes has been easy. Plus, I've had much more increase in energy and stamina. So if I had come to you as a patient in December and you said, you need to give up grains, you need to give up your daily piece of candy that you're eating, you need to go out and move your body, I would have laughed at you and said, I can't even get out of bed.
Yep.
I'm eating just to stay alive right now, and I'm just grabbing whatever I can. So again, I don't want to put words in your mouth, but have you seen possibly a shift maybe with patients you've had for a while that once you integrated the ketones, they were more able to follow through your recommendations?
Absolutely. Yeah. I'm thinking of one particular patient that we've treated for 15 years, mostly chiropractic, but every 18 months to 24 months, she wants to lose a little bit of weight. And so she'll go through some of our protocols and she will lose the weight. But what we've found is that she doesn't, because the brain's not been engaged fully in the past, she's not been able to stick to it. I've been blessed. I have been overweight in my life, but for the most part, I've been an ideal weight. So I don't understand completely from a patient perspective. I do understand from a clinical perspective. So we're about 6 months ago with this particular patient. What we've done is we integrated slowly with her. We integrated because slowly from the standpoint she's failed, and so she's kind of on a unstable ground. Like, oh my gosh, here's one more thing that I'm going to try, and I'm just going to fail at this. So we had to get her over that first. And once she started just simply drinking the ketones and introducing the ketones into her body, she just started feeling better. And once we got her feeling better, she was ready to make the changes to start to walk, to exercise, or start to pull out carbohydrates or the piece of candy or the extra piece of bread. And we realized that we just had to go much, much slower with her. So yes, we have noticed those changes. Research is starting to show not only are ketones a metabolic source, meaning they're a very good fuel source for the body, but they're also what we call signalers. They're also communicators within the nervous system that we didn't even know existed up to this point. And so when we start to introduce the ketones in an exogenous source like this, we can shower the body and the nervous system with a signaler, something that will turn on or turn off certain metabolic pathways. And we're finding more and more of those pathways that are turned on and or turned off have far-reaching health benefits. So when somebody can't get over having that piece of candy or having that piece of extra piece of bread, and we can give them an exogenous ketone and they can turn off the signal or turn off the desire to do that, then their compliance goes up from there.
Right, right. So I was just at the Keto Academy the last couple days where they had some very impressive researchers there that are working full time looking at both ketogenic diet, ketosis, and using exogenous ketones. And, they talked a lot about the brain and how they're seeing things like there was one medical doctor who worked extensively in the military and worked with brain injuries, that the response when you integrate the exogenous ketones as far as healing their brain is significantly improved. Can you just address real quickly, I know we're running out of time, can you address real quickly, what's actually happening in the brain when you take the ketones that would allow, ADD and some of these other brain, Parkinson's, Alzheimer's. Well, what do you think is happening in the brain when they take ketones that's allowing the brain to, work more efficiently?
Sure. I think in a disease state, and again, a lot of this information can be found out there in a disease state. We'll use Alzheimer's specifically. What's happening is that the brain's starving. We've fed it a poor diet for a long time, and it's not extracting the nutrients the way it should, and it's not using the fuel source the way it should. And so those cells begin to die off, or at least they begin to not function properly. And when we give ketones is a fuel source and the nervous system loves it. It's probably the primary preferred fuel source. So when we actually start feeding the brain with ketones, the cells can now go through a reparative process that they were unable to go through. Using you as an example, you said, listen, some days I was just getting up and just eating, and that's all I could do. Well, let's imagine that's our brain cell. Our brain cell, all that it can do is just get the basic fuel source. It can't do anything extra. It can't repair itself. It can't clear out some of the byproducts from metabolism as effectively as it should when it was in a healthy state. And now we can feed it a better fuel source. And then once it starts using that fuel source, it turns on all of those healthy metabolic pathways so that the brain can begin to repair itself. So I think Alzheimer's is the easiest one, but then when we get into Parkinson's or we get into ADD or we get into any of these other, brain-based diseases, and ultimately every disease that you have is a brain-based disease. It's your brain that's monitoring your diabetes, and it's your brain that's monitoring your kidney function. And so if we can get that brain fed and get it fueling the way it's supposed to, then the sky's the limit, so to speak, in terms of your recovery and in terms of health.
Are there any potential negatives with taking ketones that you can think of?
Off of the top of my head, I cannot think of it because it's in a natural state. So originally the way the body produced ketones is in starvation. So obviously that's an unnatural state, but it's a natural state. It's a mechanism that's set up so that your body and the organism can survive. So ketones from that standpoint, I can't imagine them being negative.
So I saw one comment on Facebook about, well, if you take ketones, your body will forget how to produce its own ketones. And to me, that didn't make any sense. And that, that their thing was you shouldn't supplement with ketones. So do you have a comment to say about that?
I don't. I guess it might. Playing devil's advocate, I'd say, okay, if you eat too much sugar, does your body does it forget how to make sugar? If you go into starvation, and that's being devil's advocate. No, it's not going to forget to do that. Like the body is a survival-based organism. So it's not going to forget how to do something. It just shifts its focus from one area to the next.
Well, I want to thank you. I know we're out of time. I know you have a very busy schedule today. I really, really appreciate your time and your expertise in this area. So thank you very much for your time.
It's been a pleasure. Thank you so much for having me.